Good morning, Zinzi. We have been informed like other 2 or 3 schools have been affected also with this malaria outbreak, apart from Singore, where we are informed that 1 girl died because of this malaria. And Elgeyo Marakwet is this new case here because it's also an area that is prone to malaria, especially in the Kerio Valley. But here now residents are worried that malaria is now affecting schools, especially those Form 1s who are joining schools. So they are asking, is it because of climatical change or what? But let me talk to Elgeyo Marakwet Deputy Governor Wesley Korir Rotich, if I'm not wrong, Wesley Rotich. Governor, what is the situation so far, if you can just assure and for the benefit of the viewer in the nation?
Thank you very much, Wanyama. First and foremost, I want to say that for a very long time we've not had a malaria outbreak in Elgeyo Marakwet County, and I think due to the long rains that we experienced towards the end of the year, I think it allowed the breeding of this malaria carrier mosquito, and I think that has caused an outbreak, not even in Elgeyo Marakwet alone, but in other counties. And we want to say that previously, some few weeks ago, we didn't have enough drugs, but I want to confidently tell our people that there is no cause for panic now, because we have supplied enough drugs along the valley, and even as we speak, I'm in the referral hospital confirming another batch of drugs that is going to be distributed today. And our entire team, senior officers, medical officers, will be going along the valley today and tomorrow to monitor the situation. We are also looking for testing kits so that we can be able to test you instantly and be able to treat. Our only request to the public is that let's not go to the hospital when it's already too late. When you see some signs of sickness, especially when you come from the Kerio Valley, please let's visit. Those children in institutions, we have eyed our principals. If possible, they should not. They should make sure that they refer the kids very fast to any nearby. We have 129 facilities, and I think all of them now we have stocked with malaria and malarial drugs. And also, we would want to request the schools, if possible, we should do the spraying in all our dormitories and even our classrooms, so that at least we do prevention. Our entire public health team also is doing their best to ensure that any waters which are stagnant, we advise the community accordingly, and also to sensitize the community on how we can prevent this thing.
Governor, maybe how many schools have been affected? How many students affected? And why is it that maybe only Form 1s who are joining Form 1s are the most affected ones?
Yes, Form 1s are the most affected ones because some of them come from other counties which are malaria prone, especially when you talk about Nyanza region like Oma Bay. One of the child comes from that place, others come from the Kerio Valley. So I think these are things that probably they had been affected before they joined the school, and it's getting them in school. And that's why we are saying all principals, all our facilities now are ready for you. We have recalled all our staff who have been on leave, so that we can be able to deal with this menace once and for all as we continue with the preventive measures. We are also currently trying to distribute for our pregnant mothers and children under, I think, 5. We have nets for them that we are going to distribute. Then malaria, the national government also, we are also in touch with them. We want to see if they can be able to support us to get nets for the other population, because we only have nets for children below 5 and pregnant mothers, because those are the most important people that we want to know, but we don't have for the population. So we need to use spraying. We want to get nets from the national government enough for us to be able. So our governor has given express order to the department to ensure that this thing is handled quickly and we're able to arrest. Otherwise, we want to tell our people not to worry at all.
Thank you. Thank you, Governor. Zinzi, let me talk to the hospital management here. Sir, what is your name? What is the condition for those pupils who have been brought to your hospital? How many are they, and from which schools?
Okay, thank you very much. My name is Dr. Kimaile Benjamin. We had some students, 4 from Singore, and there is one from Patrick's and another one from a school down there near Chegilet. A few of them were discharged yesterday. We have 2 remaining in the wards.
Do you malaria around?
Okay, we received enough drugs last week, So we have enough drugs for the entire county. Yes.
You mean a referral hospital that in Elgeyo Marakwet entirely, you didn't have malaria drugs all along until this incident happened?
No, it is not true that we did not have enough. We did not have drugs. We had drugs, but they were not enough to serve the entire county. So there are some facilities which were having some challenges. But as a referral hospital, we had drugs for our patients. Yes.
Thank you, Dr. Since as you have heard from the Deputy Governor here and the hospital management, we are at Iten Referral Hospital. They are saying at least 4 of them were treated, one from St. Patrick's High School, just a neighboring here, and also Singore High School, which is just some few kilometers from this particular referral hospital. But they are saying they have been treated them, they are okay, and just 1 or 2 that are still in wards and are being still attended to. So we will still follow up on this story. We also want to move to that school and see what situation, what maybe they have taken to ensure that malaria is not really attacking those students who are in school to